Welcome to this month's Minute with Victor, where Dr. Cotton answers your questions.
This month's question comes from a physician who writes, I recently took over a medical practice from a doctor who left the area. I use the same office and have all the records, but I haven't yet seen most of the patients. My dilemma is that these patients call for medication refills and other things. Because I've never seen these people, I don't feel comfortable treating them, but my office manager tells me that I have to. I'd like to know if I'm responsible for these patients. The question of whether we're responsible for someone's medical care hinges on whether the person is our patient. If I'm your patient, you're responsible for my care. And if I'm not your patient, you're not responsible for my care. So the issue here is whether these people are your patients. Now, you haven't had any contact with them. You haven't advised them, examined them, or treated them in any way, and that means that you haven't formed a doctor-patient relationship with them. Remember, in order to form a doctor-patient relationship, you have to interact with the person, and you haven't done that. So it's tempting to say that these people are not your patients, which means that you're not responsible, and I think that's the answer you're hoping I give. But we need to be careful here because there's another way for someone to become your patient, and that occurs when you cover for another physician. When you cover for someone, either for the weekend or, in this case, on a permanent basis, you step into their shoes. Their patients become your patients. Their obligations become your obligations. On the day that you took over for this physician, his patients became your patients. All of them, before you saw a single one of them. And that's the exact same thing that happens every time we cover for someone. Of course, the dilemma here is that you can't see all these people in the office at once, so you're going to have to treat a few of them before you actually see them, and I think you use your best judgment as to how you do that. It's not a perfect situation, but the legal expectation here is the same as it always is. You take care of the patient as best you can, and as long as you do that, the law will usually take care of itself. Thanks again for listening.